opening the clinic again? Like, how are people gonna? I know advice has come out from some of the industry associations of how to actually do that in practice. But I mean, what are your thoughts on that?
That's a great question, absolutely great question, in the sense that there's so much uncertainty. Now, interestingly, there was a paper published about 4 to 5 days ago. It came out of India. They spoke to different leaders in different countries, and they collated a potential plan of what a clinic would look like after COVID, and it was primarily focused on infectious control. You've got to up those levels. You've got to reduce footfall through the practice. So this may mean pre-scheduling patients. So you're not going to get that new patient walking through the door. It's going to be a patient who's made contact through email or been recommended, through a telephone, and then you've done a video consultation with them, just done the triaging. The trace and track app, I think, will play a big part as well. From what my understanding is that it has a Bluetooth handshake. So essentially, whoever's got the app, if you cross paths with each other, the app will recognize that. And it's very dependent on everyone putting in the symptoms, updating it, letting the app know if they were tested, if they tested positive, because then that will ping off whoever they cross paths with. And from a clinic point of view, for us, that's very important for our patient then to feed that information back to us. It's going to be a big change. We've got to protect our staff. That's a whole different ball game as well. We have to set the staff at high risk. It may mean having less staff in the actual clinic, reducing the footfall through the clinic, and trying to adapt in regards to that. So it's going to be challenging times. I think it's, we just have to stay positive and put our contingency plans in place. I'm sure everyone's been working out how they want to go back and what the plan is. But we just have to make sure that safety is key. As long as we ensure safety and we put our plans in place, we should be okay. So I'm very positive. So.
Yeah, no, but that's good though, because there's been I think enough worry and fear and negativity, and rightly so. But I think at this stage, at least we do have a bit of a light at the end of the tunnel, hopefully. Yeah. So this is probably a good time for people to start trying to be a bit more positive and thinking, well, I might have to. It may mean less patients, but at least I can hopefully start seeing some again.
Exactly. It may be changing to tactical. I know a lot of clinics are now moving more to skincare as well, which is a different arm. Everyone to adapt and expand. So it could be, it's a positive as well.
Yeah, I've just noticed, I forgot to say, everyone, if you've got any questions, you can just type them into the Q&A chat box, because someone's actually just asked Ravi, and I'm guessing if you could clarify, who Deepak, who asked the question, has asked, has COVID made it easier or more difficult with your supply chain? And I'm guessing you mean with skincare and with skincare sales. Correct me if I'm wrong, but how's that been, Ravi, for you? Like, has it, because a lot of clinicians I've heard have actually been saying, God, our skincare sales have gone through the roof.
Yeah, no, I agree. So initially, when there was so much uncertainty when lockdown took place, there was a little dip. It wasn't big, it was a little dip. But since then, skincare, we do a door-to-home delivery system. We do video consultations, we go through a full skin consultation, and anything that we order reaches our clients and patients in about 2-3 days. So actually, from a skin point of view, it's been great. It's been probably the best we've had it.
Yeah.
From the aesthetic point of view, we've not been putting many orders in, but again, speaking to our reps, they've reassured us there's no real issues there either. So, like, commendable. They've adapted to the situation and they've helped us to keep certain aspects of the clinics going.
Someone else has just asked, what's the name of that research paper you were talking about? If you can't remember it.
It's Consensus Guidelines for Preferred Practice in the Aesthetics Clinic. It's by Dr. Krishan Kapoor.
Okay, I might just
I can send that to you later.
Yeah, if you send it to me, I'll ask Ravi to send that to me, and I'll pop something on our website, guys, so you can access it. Okay, so another question. Yeah, so do you believe, have you found that video consultations provide more challenges to doing effective consultations? I feel seeing a client in 3D face-to-face would provide a better consult. And actually we've been speaking about that on some other things we've been doing, and the thing of, can you actually see someone's skin properly when you're doing it through something like this? Like someone might not have the right lighting, you don't have, you know, your perhaps your observed cameras or whatever it is you use. Like, how have you found that?
To be honest, we had considered that. The video consultation for personally really helped, because I also use it in the NHS as well, so from my GP work, and we are now thinking of introducing it into the hospital dermatology clinics as well. It's not ideal, I'll be honest with you. Yes, seeing a patient face to face in person, examining their skin, 3D aspect. I love using my dermatoscope as well, doing different lesions in a different light. However, in the current climate, I really think it's the best thing at the moment, and it really helps just to the patient. And if there's not, if you're just discussing a skin regime, it's it gives you a bit more time with them, you can interact with them a little bit more, and they can have continuous follow-up. It's not the same as face-to-face, I agree, but I think we do need to adapt that a little bit more into our work in the current situation, depending on this place.
Yeah, definitely, because I mean, really, none of this is ideal.
Exactly.
So I guess you kind of just got to do what you can. But just to the person who asked that question, if it's something that you found difficult, we have a really great video that someone did for us on our YouTube, and it's all about advice to give your patients and how they can best light themselves before you set up a consultation. So Clint from Clinical Photo Pro did that video, so I'll find that link and type it in. That's really worth watching if you have been finding it difficult to do your video consults, because it just means that patients can set themselves up in the best possible light for you to see.
I watched that. That's really good. I agree.
That's good. Yeah, no, I think that would be really helpful. Okay, so someone has asked, in your opinion, once the R value drops sufficiently, and I guess we would that depends what sufficiently really means, but will enhanced PPE be necessary then?
So I don't think it's the R value is very important, but it won't be the driving factor. The driving factor will be one, the vaccine, when and if we get one. Two, the reinfectious status. Now, the antibody testing that we are trying to get through will show us if a patient or anyone has had the virus and has mounted a reaction to it. What we don't know yet is can you be reinfected? Now, that's the key, because it's no point doing an antibody test and having that and telling everyone, look, you've had it, you're okay, and we can't say with confidence that you can't be reinfected. So in our clinic, myself and my co-medical director, we've decided until we have that written, we're going to be wearing advanced PPE. Safety is paramount. I rather be overcautious than undercautious.
What does enhanced PPE actually mean compared to just like standard PPE?
So standard PPE is things like surgical masks. Enhanced PPE will be your respirators, your FFP3 masks, which you usually get fit tested for. So it's anyone that's doing aerosol treatments. So this is the equipment they're wearing in ITU. I think that, or anyone that's doing surgery, dentists as well. That's their key point, because they're going to be one of the most exposed. And I said to my wife's dentist, and I got told her the same, they're the most exposed when it comes to going back to work. So that's the fine difference.
And at this stage, is there a concern about supply chain of this enhanced PPE? Like, is everyone going to be able to get it? Like, where are you getting it from your practice when you reopen?
Again, another good question. We've all heard the troubles that the government has with the PPE and the stockpiling issue. Now, prices of PPE has slightly gone up. It's understandable. Ours have come. I have again reps. Ours have come out of China as well. The ones that they weren't using, now we're getting them back into Europe. So that's where we've sourced ours. We also invested in respirators. There was a good study from the States that compared all the different masks available. I've actually got mine downstairs somewhere, but I keep that at home, and then I can take whichever clinic I'm doing. And it's the one where the outer filters get changed. So it's a good way to clean the mask and keep it disinfected, really. But yeah, there are, PPE is increasing, so the availability is increasing, and we just have to make sure we have the right type.
Yeah, and I guess really the bottom line is if you can't have it, or if there's a delay on you being able to access it, then you just don't open, do you?
Exactly. Again, it comes back to the safety issue. And we've always done it, and we're always going to continue doing it. I think these are just very special measures where we just have to look back even closer to what our protocols are.
Yeah, and it's in this industry, like you say, it's not like this is a new concept really to anyone, because everyone's used to having like the highest hygiene standards and health protocols and stuff.
Right. Now is the time just to take that to the next level.
Yeah.
Sure, we will. I'm not sure. I know we will, as a field.
So another interesting question from someone. I know we were speaking a little bit earlier about how patients were kind of reluctant to come forward if they just had a kind of standard medical issue, because they thought it was perhaps wasn't important enough or something, like in the current climate. So someone said people may be less willing to seek help or advice for dermatological issues because skincare isn't always viewed as life or death. And Ravi, why do you think it's important to maintain a good skincare regime and or seek help where unusual skin issues are discovered? Like, so even at the moment, if someone was to have a dermatological issue, why is it still important that they would be encouraged to come forward to their practitioner about that?
Well, the key answer is, do we know what that question is? Do we know what that rash is? Is it a simple rash? Is there something more? I've had a couple of patients in my GP clinic where they've delayed seeing us because of lockdown. We've managed to get them in, and it's turned out to be skin cancer. It's really a simple rash. It comes down to as simple as that. If you don't know what the rash is getting worse, or the lesion is getting worse, rather than sitting on it, you need to get it checked out. And I'll come back to the answer before, is we don't know when COVID is going to go away or what's going to happen. But what we do know is the patient with the issue now needs to be seen and treated. And the longer we leave it, the more complications that we can see. And it's simple as that, to be honest. From a skin regime, I think the question was, why do we need a good skin regime? That's more just to make sure that, we look after ourselves. I'm going to now put my aesthetic cap on, and it's making sure we have a good skin. Skin is what everyone sees. It has a big impact on mental health as well. So looking after your skin, I think, is paramount. Absolutely paramount.
Yeah, and actually that's an interesting point, because I think, there's been lots of talk about how this whole lockdown period is going to impact people's mental health, as we all know. And that everything kind of feeds into that, doesn't it? Because if people are kind of dropping their skincare, or even some things like, I've been finding that I have a more productive day because I feel better about myself if I put a bit of makeup on before I'm working, like even just sitting here from home. And I think a lot of people have found the same. So I think dropping those things that we normally do to look after ourselves and keep ourselves kind of healthy and looking how we want to look, really, I know it may sound silly, but have a massive impact on our mental health. And that might be the same for patients if they kind of drop this stuff now.
Definitely. I think, the key is to have that routine. Skin regime gives you that routine.
Yeah.
It's very easy to drop things like that, but having that routine in the current situation where you can't go out and do what you would normally do, having some sort of order where this is what I'm going to do, it works wonders. And that comes down to exercise, that comes down to healthy eating, it comes down to all aspects of life at the moment. How is your skin regime going?
Yeah, it's all right, SPF? Sorry?
Your SPF?
Oh yeah, absolutely. I'm so pale, I have to. Yeah, F50 every day for me. I'm at my mum and my stepdad's house in Bournemouth, so I can't believe I'm going to say this, but I've been using Nivea moisturizer because it's all that's here. Because I normally use I've been using exuviants, but I've kind of, my clinical skincare's run out, so I've had to use my mum's Nivea moisturizer. But
well, it's uncharted times.
yeah, no, exactly. We're all having to make sacrifices. Okay, so someone's just asking your advice on dietary impacts on the skin. So, and kind of linked to that, what are the key things to look at when considering, so perhaps a skin issue becoming more sinister that you've worded it, but perhaps what are the dietary things that you might first look to if someone's presenting with a perhaps a quite kind of advanced skin issue?
So interestingly, we're going to be doing a very good post about this on Monday. We've looked at different types of good food for your skin. When it comes to seeing patients, acne is what we always link sugary foods and things to. But I think having a healthy diet in general is good for a patient, good for everyone. I mean, a patient is good for everyone. So, you know, avocados, your hydration, your vitamin C's, if you get it through a diet, it will show on your skin as well. And in regards to what you should look out for your sinister signs on your skin, so I'm going to put a little disclaimer here. If you have any concerns, always speak to a doctor. But usually it is any lesion that's getting bigger, bleeding, becoming irritated, irregular. But again, with the disclaimer, if you have any doubt, speak to your GP first, and they will organise for you to be seen.
Yeah, but I think it's good as well for practitioners who to be aware of these things, as I'm sure it would be, like if you're not a dermatologist, but you are performing aesthetic treatments, to know what to look out for, so that you can always advise your patients to like refer themselves to their GP.
Yes, I'm the same as well. Any lesion that I'm unsure about, I won't treat. We're not scared to say no to anything that we're not happy with. And I think majority of our colleagues in the field are the same. They will never treat anything that they have doubt about. And that's the safest thing to do. Again, like we keep coming back to the safety of patients key.
Definitely. So are you still at the hospital at the moment? And you're based in Milton Keynes, aren't you?
So our aesthetic clinics, Skinspire, the base is Milton Keynes. We've got a clinic in Watford, Hertfordshire, and East London, so South Watford way.
Okay.
Just
outside. So what hospitals have you been working in?
So from my dermatology point of view, I work at Royal Free.
Okay.
So I've now gone back. We are slowly going back to some sort of normal clinic. So a lot of it is still telephone triaging, trying to help as much as you can, trying to get patients to send photos in if they can. We are looking to introduce video consultations, but as you know, correctly said earlier, sometimes you just got to see the patient face to face. The hospital's taking extreme precaution, and rightly so. So everything that we're trying to do is just taking a little bit of the time to get in.
Yeah, because someone's actually asked, what's it like at the hospital at the moment? How have you seen, is it still kind of at the level of madness as it has been for the last few months in terms of just like in general?
It's calming down. Speaking to colleagues at different hospitals as well, it's definitely calming down. They're not lowered anything, but from a footfall point of view, it's calming down. How has it been? I'll be honest with you, when I went back, I got ID checked as I entered the hospital. I thought I was entering a club and there had been ID checked. But everyone is following all the advice given, the social distancing, masks, only the most needed clinics are taking place. The cancer clinics, for example, are still taking place. So I do minor surgeries as well for lumps and bumps. We had to cancel majority of the list, triage the list, but it had to be done as soon as possible. However, we're hoping to be restarting that soon as well. So there are some normal aspects now coming back into practice. It's nice for us, we want to start seeing our patients as well and have that personal touch.
Yeah, definitely, because especially if your regular patients who you sort of develop those relationships with, and I guess if you were sort of in the middle of or just getting someone started on a real kind of regime to improve something or a proper treatment plan, and then you've had to kind of put it on hold, and that must be quite distressing for patients as well.
Definitely. To be honest, patients have been very, very understanding, and especially my consultants I work with have been amazing as well, and they have in all fields. They've looked after the high-risk patients and made sure plans were put in place. All other patients were triaged, appropriate follow-ups were put in place. They have regular contact if need be. We have emergency numbers. There were plans in place, and I think that was the key. Everyone planned and weren't scared to implement them as fast as possible, and then adapted. If something wasn't working, it was changed.
Yeah.
And we recommend the hierarchy in doing so.
Yeah, absolutely. So someone has asked if you, so someone is based in Durban, South Africa, would like to know if you do video consults with patients outside of the UK. I'm not sure if this person is in the industry themselves. Maybe they are, and they want to talk to you perhaps about their skin, or whether they're just interested to know whether you do that with patients outside of the UK, because I guess that might be another consideration about like timescales and internet connections and that kind of time zones and stuff. So yeah, do you do that? Would you do that?
No, not at the moment. I have a couple of queries from in India as well recently, but no, unfortunately not. Only because we can't treat you, so I can't get you the treatment that's required. Then follow-up becomes an issue. And if I need to see you face to face, that becomes an issue. Now for myself, if I can't give you the whole package, I'm not going to do bits of it.
Yeah. No, that's
if you're in London, come see me.
So what advice have you got for people? And we did something in the mag on this actually, but looking after the hands, both for practitioners and advice to give to patients, because it's obviously something that everyone's experiencing at the moment. So like for super dry or sore hands from all the hand washing and sanitizer and stuff, like what have you been doing personally?
So I'm a big fan of Dermal 500. Unfortunately, it's not been tested against COVID-19. We used to use it in theatres as well. So when I do my minor ops, I do scrub with it. But because it's not been tested against COVID-19, what I do personally is I don't use any alcohol gel itself. It's wash your hands and then re-wash with the Dermal 500 and then reapply Dermal 500 after you've dried your hands. You should never rub your skin to dry in general, especially your hands. You should always dab to dry, keep it a little bit hydrated, and then add the Dermal 500 on top of that.
Yeah.
If you're
sorry. No, I was just going to say, is that something that you need a prescription for, or can you buy that over the counter?
Yeah, over the counter. It's readily available over the counter. The other is if it's progressing, so it's contact dermatitis essentially, is the alcohol in the solutions that's causing the irritation. And you can start developing cracks, which can get infected. So a good steroid is paramount as well, and the right type of steroids. So again, seeing a doctor who understands the skin a little bit more, getting the right type of steroid, not being afraid to use it. Nylon gloves at night, reapplying your creams and putting on nylon gloves at night just helps the absorption of the cream. Putting gloves on when you're doing other types of washing, bathing children or washing up, and regular emollients throughout the day. The article is still available. We go through it step by step in what you can do depending on what level of the irritation you have. But I think the key is getting that hydration back into the skin. The 500 has got an antimicrobial aspect to it as well, so it just gives you that extra level of protection.
Cool. Okay. Lots of great questions. So someone's just asked again, so will aesthetics the return in July, or is that a moving goalpost? That is very much a moving goalpost at the moment. It's the preliminary date that we've all been given like we were saying earlier, for sort of beauty salons, etc. So aesthetic clinics fall into that. But yeah, that's very, very much changeable.
Phase 3, from a government point of view, but yeah, no, it's forever changing at the moment.
Yeah, definitely. So let me just read this one, it's quite long. Yeah, so obviously as a dermatologist, but perhaps more so as an aesthetic practitioner, you always have to deal with the aspect of mental health checks when patients come in, and making sure that someone isn't suffering from BDD, or that they're in the right frame of mind to be wanting to access that treatment. But someone has made the point that at the moment, especially, people's appearances are being scrutinized more than ever. And I read something the other day about video consult requests for plastics procedures has gone up massively whilst we've been in lockdown, because everyone's doing stuff like this on Zoom and just looking at themselves all the time. So this person has said, how do you approach the issue of people who want aesthetic treatment versus not taking requests for kind of superficial or something that you think isn't suitable for that patient, especially perhaps when we come out of lockdown, that kind of might be going up even more. And does the fact that you work privately and publicly help in that regard?
Yeah, no, definitely. I think it's also the fact that we spend a lot more time on social media now. We have a lot more time. It's very important to assess the patient that's in front of you, to ask the right questions, to see what their goals are, and if they are realistic goals for the person sitting in front of you. And I think that this is where video consults will play a bigger part when we're going forward, because any pre-assessment can be done. That history can take a little bit longer when you've got someone in a video rather than having someone in clinic because of the interaction time. So you can spend a little more time assessing that. But it's all about the history. It's all about assessing their goals, and you're going to come back to it again, is this something that is right for the patient sitting in front of you, and what they're telling you, what they're asking for is appropriate. And it's not easy. It's not easy, but I think the more we see patients and the more we assess patients, the better we get. I'm lucky in the sense that because from my GP background, we deal with a lot of mental health in the community. So our assessment, personally speaking, or my assessment, personally speaking, starts as soon as the patient walks through the door. Yeah. Interacting with you, eye contact, demeanor, body shape, it all plays a part and feeds into your assessment. And so personally speaking, my GP background has really helped with that. And also the fact that we have to practice within 10 minutes. So we have to get information out in 10 minutes. So having a little bit longer to do that, I think, would be even more helpful.
Yeah, but it's always about so much more than just what that person's coming in asking for, isn't it? And even down to like full face assessment, harmony, balance, all of those things we always talk about in aesthetics, and that person's face kind of overall, if it's the face you're dealing with.
It's the holistic approach. You're the person, not the that singular point they're asking for. And you can get through that having a conversation with them. You have to get the patient open up to you. Yeah,
definitely. Okay, cool. I'm not going to keep you too much longer, but yeah. So I guess I just wanted to ask, going back to how we think the industry might change now. Do you think that patients will be slightly reluctant, maybe at first, to be booking in for their aesthetic procedures, just because of thinking, I don't know if it's safe to be in that kind of environment?
I think that's definitely a fair part, yes. And it won't be just booking into the clinic, it will be then commuting to the clinic.
Yeah.
There's a big issue with the whole, train, no trains.
Yeah, and I guess if clinics perhaps don't have parking facilities.
I apologise. Sorry, say that again?
No, I was just saying that the clinics who don't have parking facilities on site, and that might be difficult.
So I think the whole patient journey will have to be looked at, and there will be initial hesitation, but as we can reassure patients more and more, put all the safety measures in place and patients see that, I think that worry will slowly go to the back of their mind. I think it always will be there. It will niggle away, but the more we can reassure, the more we can do for the patient, I think hopefully we'll go more and more to near normal as possible.
Mm. And do you think that there's going to be any difference in terms of like what treatments will be most popular? I guess that probably won't change, will it? Like if someone's a a regular like toxin patient or something, that's not going to change.
Yeah, I think the regular patients will be more forthcoming when we reopen. Yeah, and I agree with you. Patient and clients like the treatments they get done, and I don't think that's going to change by much.
Mm, mm. Cool. Well, I think so. That's the last of our questions that we've had come in. Unless there's anything else that you particularly want to add, but I think that's been a really good discussion.
No, thank you so much. I enjoyed that.
Yeah, really interesting. What I'm going to do is I'm going to type in here. Oh, hold on. I've just seen some more questions. Right, so someone's asking about insurance. Now, again, this is really tricky, and I'm obviously not an insurance expert, but I've been talking to a lot of people about this industry. It's very tricky for this to kind of be answered definitively, but do we need different insurance to cover us in case of staff or a client catches COVID-19? Can we face someone putting a claim on us? People may catch it right. So basically saying, would it be a possibility that a patient could catch COVID after having been to the clinic and had a treatment, and then somehow be able to kind of pin that on you and say they caught it on your premises? And is there a way of protecting against that? I don't know if you've got any thoughts on that.
I think the best thing will be to check with your insurance provider. Make sure all your safety protocols are to be at optimum. You just don't want to leave yourself exposed.
Yeah.
Don't leave yourself exposed. Yes, it's difficult to say where that infection will come from, but if your safety protocols aren't to what they should be, that can be questioned. But definitely check with your insurance provider what their guidance is on that and take that on board. That's what
no, definitely check with your insurance provider. And I would say also just make patients, with all of this stuff that you're doing to safeguard the clinic and all your health and safety practices and how you're adapting, just make patients really aware of it, like shout about it on your social media, send out kind of email documents to regular patients, just let them know that you're doing like the utmost to protect them when they're in the clinic.
The more you interact with your patients, the more grateful they will be, the more safe they will feel. And the more safe they feel, the more they'll come to see you when need be.
Yeah, definitely. Okay, fab. I'm going to just type in this box. Ravi, can you just remind me the name who authored that paper, just if anyone, I'm going to just type it.
It was Dr. Krishan Kapoor, Krishan. So it's Kapoor. Maybe it's consensus guidelines for preferred practices in a aesthetic clinic.
Okay, I'm just going to type that. Cool. So anyone who was interested, have a look at that paper. Oh yeah, the YouTube link. Bear with me. I'm just going to find that link that that video that Clint did for us on getting your patients lighting themselves properly for consults. This talk is also going to be on YouTube, everyone, so you can watch back if you perhaps missed the beginning or anything. So that will be on our socials and things. What am I doing? Sorry, this is like real time of me trying to find what I'm looking for. But I just want to do it before we go. Okay. Okay, cool. I'm gonna, now you can hear it.
Well, while you're doing that, I was just going to say, if anyone has any questions that weren't answered and want me to answer, just reach out through our Instagram page. I'm more than happy to be contacted.
What is your Instagram, Ravi?
It's skinspire.official.
Cool. Yes, so please do, if there's anything else that you'd like to ask, and if there's anything else that you would like to ask us from an AM point of view, you can always just drop us a message on any of our socials as well. And we are on Aesthetic Med Live on Instagram. I always feel like I get that wrong. But okay, cool. Well, thank you so much for joining, everyone. Thank you for your questions. Thank you, Ravi. That was fab. And yes, have a lovely weekend. And let's definitely check in. Perhaps we can check in with everyone again in a month or so, in July even, and see how we're all getting on. Cool. Thank you so much. Have a wonderful day and a wonderful weekend, everyone.
Bye.
Bye.